Robert F. Kennedy Jr. has a lot of ideas about how to reshape healthcare in America.
He's a skeptic of vaccines and has spread baseless conspiracy theories about them.
And he's going to help make America healthy again.
Now, he's President-elect Donald Trump's pick to lead the Department of Health and Human Services, which includes the Atlanta-based Centers for Disease Control and Prevention.
I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
Potential changes are worrying public health experts.
There will be a slew of administrative actions, including potential restrictions on medication abortion. That could also include major changes at FDA and CDC.
A few blocks away from HHS near the National Mall is another brutalist building, this one home to the Department of Housing and Urban Development, where policy shifts are also expected.
While the Biden administration was largely too little and too slowly for renters across Atlanta and the rest of the country, there will be even less done under a Trump administration.
Today, we continue to look at how the new Trump administration could affect Georgia.
On this episode, we talk about health and housing. I'm WABE Politics reporter Sam Gringlas.
I'm WABE Politics reporter Rahul Bali, and this is Plugged In, a WABE Politics podcast. We begin today's episode with WABE health reporter Jess Mador. Welcome back, Jess.
Thanks for inviting me, guys.
Okay, Jess, Trump's team on health is beginning to take shape, including picks to lead the Food and Drug Administration and the Atlanta-based CDC. But the selection drawing the most backlash is Robert F. Kennedy Jr., who's been tapped to run the United States Department of Health and Human Services. Now, one of the reasons this pick is so controversial is because RFK Jr. has promoted conspiracy theories about vaccines. But first, let's just take a step back here. Jess, remind us what HHS actually does.
HHS, the U.S. Department of Health and Human Services, is a massive federal agency. It's one of those federal agencies that you may never have heard of, but it has a humongous range of things that it does, and it touches every American's life in one way or another, even if you are not aware of it. So it oversees scientific research, medical research, drug, vaccine, food safety, safety net programs like Medicare and Medicaid. So HHS also includes the Centers for Medicaid and Medicare Services, otherwise known as CMS. CMS sets Medicare payment rates for hospitals, for example, doctors and other providers, and it provides health coverage through Medicaid, Medicare, and the Affordable Care Act, also known as the ACA, Obamacare, for more than 160 million Americans. And HHS also oversees the National Institutes of Health, or NIH.
Okay, so let's talk about the ACA. Trump and many Republicans have long talked about repealing it. We don't know how likely that is this time around, but we still could see changes to some of the provisions in the ACA that affect how Georgians get access to health insurance. What are we talking about here?
Yeah, that's right. And the Affordable Care Act, the ACA, it's popular. It's seen record signups over this last year, over the last several years. And one reason for that is that the Biden administration has enhanced ACA subsidies that have cut people's monthly premiums significantly. And those are set to expire at the end of next year unless Congress extends them. And, KFF, which is a health policy and research organization, has estimated that if those subsidies expire, that would cause people's premiums to rise, by a lot, and in some cases, even doubling. And that could cause marketplace enrollment to drop sharply.
So one of the agencies you mentioned at the beginning of this segment, the Centers for Medicare and Medicaid Services, CMS, President-elect Trump has tapped Dr. Mehmet Oz, the TV host, to lead that agency. What can people who rely on Medicaid expect in the next 4 years?
Well, of course, we have to see how things play out. But so far, we know that some Republican-led states across the country have talked in the past about trying to add work requirements to Medicaid. And just to recap, Medicaid is a health insurance coverage program for people with disabilities or extremely low incomes. And Georgia is the only state with work requirements for Medicaid. It's been in effect for about a year and a half. It's Republican Governor Brian Kemp's Georgia Pathways to Coverage program. And that program requires people who want Medicaid coverage, who qualify, to work, train, do education, volunteering, approved activities for 80 hours a month in order to get that health coverage. The program has seen sluggish signups. The state's been working to get more people to enroll in the program. So far, it really doesn't seem to have caught on much, but we could see more red states try to pursue similar work requirement programs under the Trump administration. And, another thing we could see is a change to how the federal government funds Medicaid with states, because Medicaid is a state and federal program.
So, Jess, correct me if I'm wrong, but my understanding is that the feds can grant states waivers that allow them to do things like add work requirements to Medicaid benefits. The first Trump administration initially granted Georgia a waiver to do a work requirement. Then the Biden administration revoked it and the courts got involved. It was very complicated, a lot of back and forth. But more broadly, could we see more of these kinds of waivers for things like work requirements being granted under the Trump administration?
Yeah, we could see that because this is how Georgia's Pathways to Coverage program got started in the first place. It was under the first Trump administration when Kemp applied for what's known as a waiver, like you just said, in order to create this work requirement program. That program is actually set to expire next year, but it's likely to be continued at least in Georgia.
So let's talk more about the Atlanta-based Centers for Disease Control and Prevention. First, remind us what the CDC does.
The CDC is the nation's top public health agency, and it's overseen under HHS. It's alphabet soup of acronyms, but the CDC is charged with protecting Americans from disease outbreaks, pandemics, COVID, public health threats, and more everyday things, deaths from drownings, drug overdoses, shootings, and chronic diseases, HIV, AIDS, maternal and infant mortality, and the list goes on. And the CDC, issues guidance, as we know, for when to get vaccinated against the flu, other illnesses. And it has a big budget. It's got a budget of around $9 billion with a B, and thousands of employees and contract employees as well. And it's important to note that a lot of the funding for state and local public health work actually comes from the CDC and from Washington.
All right, so what do we know about Trump's plans for the CDC?
Right now, we don't have a lot of specifics, but we could see budget cuts. We could see big budget cuts. And, there's been talk of, quote, reorganization of the agency. RFK Jr. has said he's prepared to make big changes, and Trump has said he plans to give RFK Jr. free rein on health policy.
I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
So what has Robert F. Kennedy Jr. said on what he might do when it comes to vaccines?
Well, he's a longtime critic of vaccines, and he's spoken out many times in opposition to vaccines, and he's urged people to resist the CDC's guidelines on childhood vaccinations. He's threatened to make cuts to public health, and, he's threatened to fire hundreds of employees at the National Institutes of Health, the NIH, which oversees vaccine research. Here's an example of some of what RFK Jr. has said about vaccinations.
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective.
He's also said, people should have, quote, choice. And it's important to note that, the CDC issues guidance, but states determine their own policies. Experts say, having someone with anti-vaccine views and language promoting choice, could just further enable states and families to make their own decisions about vaccines. And if states make policy changes on vaccine mandates, for things like, entering school, for example, that could threaten to erode the progress we've seen in this country on so many preventable diseases. One thing that comes to mind is measles, for example. We've had measles outbreaks popping up in some states, and, some of that has to do with lagging vaccination rates.
So, kind of in the big picture, how could this affect the thousands of people in Metro Atlanta who work at the CDC? I was speaking to a couple of CDC employees just this week, and they said right now, people are still doing their job. They're still focusing on the work. What have you heard from employees, and are they expecting mass departures?
I mean, it's too soon to say, but I have heard talk that people who are eligible for retirement may decide to retire now. Other people who, are not necessarily eligible for retirement may just decide to leave voluntarily. And, the other impact we could see is the CDC partners with, state public health agencies and universities all across the country, including in Georgia, on research, public health data collection, and outbreak monitoring. It also partners with agencies around the world and other countries, because as we saw with COVID-19, diseases and infections don't respect state boundaries, right? So I talked with former CDC Director Dr. Tom Frieden. He heads a nonprofit now called Resolve to Save Lives, and he says cuts to the CDC would have far-reaching impacts to public health efforts here in Georgia and in other states.
Something like 3/4 of all of the dollars that come to CDC go out to state and local health departments. In this country, we have a patchwork or network of public health. It's really up to the local, city, and state health departments to get the job done.
Jess, one of the most prominent policy issues in the 2024 election was abortion rights. Trump's position is that abortion policy should be determined by the states, but he's also made some contradictory statements, and many of his allies want further restrictions on abortion. Of course, a national abortion ban could be possible, but there are also some other avenues that seem more likely that could also restrict abortion further. What are they?
Well, we're going to see how things play out, but of course, we could see a move to enact a national abortion ban. The Trump administration could also restrict access to mifepristone, which is one of the medications used for abortion. It's also a very common medication used to treat pregnancy complications, including miscarriage. And it's been approved and been in use for, more than 20 years. But there have been lawsuits already by some anti-abortion groups who've sued the FDA over its oversight of mifepristone. And one case in particular is likely to be revived soon. This is Sarah Redd from Emory-Rollins School of Public Health. She's watching for that case to be revived.
Challenging FDA's oversight of mifepristone and trying to roll back some of the expansions of access to mifepristone that have kind of come forth since about 2016 from the FDA. So that is something that we 100% know is going to be likely getting back to the Supreme Court's door.
So, Jess, what else are you watching for in this space as Trump takes office in January?
I'm going to be watching for, how states react to any policy changes at the federal level under the Trump administration. Do we see rollbacks to public health efforts, maternal mortality, child vaccination rates, addiction prevention, smoking? There's so many things that these federal public health agencies do. And I'm going to be looking for what happens with Medicaid. There are also a couple things I'm going to be looking for that we haven't even talked about today. Does Trump follow through with mass deportations? And, if so, that could have big impacts on the healthcare system. We could see families separated or, immigrants, whether they're undocumented or here legally, being afraid to seek healthcare. And, what happens with gender-affirming care? We've already seen more than 24 states that have already enacted restrictions on puberty blockers and hormones for minors. So we could see states pursue more efforts to restrict gender-affirming care.
WABE's Jess Mador. Jess, thank you so much for sharing your expertise.
Thank you.
We'll be right back. This is Plugged In, a WABE Politics podcast.
Welcome back to Plugged In, a WABE Politics podcast. We're now going to turn to federal housing policy, and our guide is WABE housing reporter Stephannie Stokes. Hey, Stephannie.
Hey, guys. Thanks for having me.
Welcome to the show, Stephannie. Stephannie, can you point to an initiative of the Biden administration on housing that might be rolled back under a Trump administration?
Yeah, the big thing that I have been thinking about is the approach to corporate landlords under the Biden administration. And when we talk about corporate landlords, we're talking about these big national companies that own many of the rentals across cities in the country, but especially Atlanta, Metro Atlanta. Some of them own single-family homes. A landlord like this is Invitation Homes. They own several thousand properties around Atlanta. But there are also big companies that own apartments. And so late in the Biden administration's term, we started to see some pretty big actions against these companies. These came not from HUD, actually. They came from different departments, like the Department of Justice. This summer, they sued a company called RealPage that helps landlords manage their rentals and determine how much to charge. So DOJ argued what this company was doing was setting rents artificially high, and that amounted to price fixing. And that lawsuit is actually still going in federal court. So that is one big thing we saw this summer. And then this past September, from the Federal Trade Commission, we saw them going after Invitation Homes, and they argued that the landlord was imposing these surprise fees on tenants. This is something we're hearing more and more about, that tenants sign up for a lease believing they're going to pay, let's say, $1,500. But in reality, once they're on the lease, they're getting charged a fee, a $50 fee for smart home technology, a fee for air conditioning filters. And these are things they never knew were going to be part of the cost of renting. So suddenly they're paying $100 more a month, or maybe more. So the FTC took a big enforcement action against Invitation Homes that a lot of people said, was sent a big message across the industry. And they proposed a settlement with Invitation Homes for $48 million. So advocates I've talked to were definitely paying attention to this, given how much control these landlords have over the rental market in Atlanta. One of those advocates is Taylor Shelton. He's a professor at Georgia State University who has studied these landlords and how many properties they own here. And he really wanted to see more done at the federal level, but now his expectations are pretty low.
While the Biden administration was largely too little and too slowly for renters across Atlanta and the rest of the country, there will be even less done under a Trump administration.
And I just want to add that the companies targeted in these actions have denied any wrongdoing.
Stephannie, we've heard Republicans talking about slashing budgets for social services and safety net programs. And I wonder, what about federal funding for housing programs? And also just what type of programs here in Atlanta could be affected by potential cuts?
Yeah, any cuts could have a really big effect in Atlanta and Georgia because there's just very little state or local funding for housing services here. So federal funding automatically plays a really big role. So we see federal funding helping people afford their rent through Section 8 housing vouchers. Those are vouchers, that allow people to rent a property at a reduced rate. We also see a lot of federal funding for services for people who are homeless. A lot of the efforts that get people off the streets and into housing, that stems from federal funding. And we see a lot of funding for big community projects through federal grants. So it's just federal funding really underlies all of these social services that are serving all these different populations in our city and in our state. So any types of cuts, are really going to be felt. In the past Trump administration, we did regularly see these types of big cuts proposed to programs. But in the end, those cuts never really materialized. So that's something to keep in mind, that I think it's pretty likely that we're going to see cuts proposed. The question is whether or not those cuts will be successful. And I'll just add that there were some programs created under Trump in the last administration that some advocates, are remembering now and they're thankful for. And one is this housing program for foster youth who have aged out of care. It's called the Foster Youth to Independence Initiative. It actually started under the last HUD secretary, Ben Carson. And it didn't necessarily create more money for foster youth aging out of care, but it did streamline the process for them and make it easier for them to get housing assistance. So advocates are highlighting that and saying, like, good things still can happen.
So, Stephannie, President-elect Trump has picked former NFL player and former Texas state lawmaker Scott Turner to lead the Department of Housing and Urban Development. Who is he, and what do we believe his approach to the job is going to be?
So I honestly didn't know much about Turner before now, but, he did serve in the White House previously during Trump's first term. He was part of this White House Opportunity and Revitalization Council, and a lot of people are remembering his role in advocating for a type of tax policy called opportunity zones. And that came about as part of this big tax bill in 2017, and it was aimed at sparking new development.
So, Stephannie, you mentioned opportunity zones. This is a program that was touted by Republicans like South Carolina Senator Tim Scott and also some big city mayors. What exactly are these opportunity zones, and how have they been used here in Atlanta?
Yeah, so the policy allowed investors who make money off stocks to take that money and reinvest it into distressed areas known as opportunity zones. And the benefit to investors is that by doing that, they could avoid or reduce taxes on that income. So all states were in charge of designating their own opportunity zones. This job landed at the Georgia Department of Community Affairs. And at the time, an expert told me that most of the opportunity zones Georgia designated were areas that really did have a significant level of poverty and met these other criteria that show that perhaps they could use some more investment. In Atlanta, we saw that they were largely in the southwestern part of the city. But there was also one that was on the east side, right next to Kirkwood, and also in the center of the city, the neighborhood Old Fourth Ward was considered an opportunity zone.
And what do we know about how effective they have been?
So like with a lot of things, it really depends on who you ask. So people have studied whether or not more jobs were created in areas with opportunity zones, or if incomes rose, or if property values went up. People have found some evidence of that nationally, but it's hard to prove that wouldn't have happened without the opportunity zones. In Atlanta, the targeted areas that I just mentioned, and places like in Southwest Atlanta, they might have had a high poverty level, but they were also places where there was already a lot of new development on the way. A lot of these areas were around the Atlanta Beltline, for example. So you could argue that those changes were already going to happen. And the other issue is that there were tons of opportunity zones across the country, but there was nothing in the law that said every opportunity zone would receive investment. So investors could just put their money into areas that were already more desirable, and then they would get a tax break in the process.
Yeah, you mentioned Old Fourth Ward, and it's hard to imagine that this area within the last couple of years wasn't going to boom regardless, given its location on the Beltline, Ponce City Market, and, kind of this hotbed of investment. That's really interesting. Stephannie, are there other housing issues you're keeping your eye on out of Washington in these next couple of months? Or is there anything advocates see room for bipartisan efforts, maybe?
I think everyone is interested in seeing if the home buying experience will change. That's definitely something we've talked about on the podcast previously. If mortgage rates will go down, that's still, unclear. Interest rates have reduced, but mortgage rates are still pretty high. So that's definitely something that I think there's bipartisan agreement that should change. The question is just how. And then something else I've been looking at is in properties that are funded by HUD that receive a lot of federal funding. There's been a longstanding issue of poor living conditions. And that's something that we've seen some action in the last 4 years. Some properties have actually been closed down and condemned, and tenants have been moved out. And that's seen as a positive development. And so interested in seeing what will happen to other properties that are struggling going forward. An advocate pointed out to me that, that's something that actually U.S. Senator Marco Rubio of Florida was very vocal about in his district, some of these properties and their living conditions. So it could potentially be an issue that, will matter to both Republicans and Democrats. And then I will just add that, regarding to changes to social services that we talked about earlier, that, really everything is connected. So you can't look at housing in isolation exactly. People's ability to afford housing depends on their ability to afford food and childcare and healthcare. So changes in those areas will also affect people's housing situations.
So much to keep tabs on. WABE's Stephannie Stokes will be all over it. Stephannie, thanks so much for your reporting.
Thanks, y'all.
And that's it for this edition of Plugged In, a WABE Politics podcast. To hear how the Trump administration could affect environment and immigration policy, listen to our previous episode. Our producer is Brendan Rivers. Our managing editor is Alex Helmick.
And if you appreciate the reporting you hear on this podcast, you can help fuel our work with a donation this holiday season to WABE. 90% of our funding comes from right here in Metro Atlanta. We rely on listeners like you to help fund critical reporting on public policy and politics.
This giving season, support Plugged In and other WABE programming you enjoy at wabe.org/give. Thanks for listening.